we are seeing really with small states is that they are struggling with their health systems, as health systems have become far more globalized, and the scale at which health systems are operating today is much larger than it was before. So, for example, whilst 30 years ago most countries had domestic pharma markets, today the pharma market is globalized. And small states on their own absolutely cannot compete when it comes, for example, to negotiating good prices for medicines in a transparent way, and they have to join forces with larger states. We also see that when it comes to training, retaining and sustaining a specialized health workforce, that poses quite a difficult challenge, particularly as health services become more specialized. Small states risk being peripheralized, and as we see, for example, even with the launch of the European reference networks, it's quite likely that small states are going to find it increasingly difficult to keep up unless they manage to network and link very well. And I think that small states, more perhaps than larger states, tend to recognize the benefits of international networking as a source of capacity building, as a means of overcoming isolation. Another area where small states usually tend to do quite well is the integration of research, policy and practice. It's often because people like myself have to wear more than one hat and sit at different sides of the table, and therefore you know what it's like to be in the other one's shoes, so to say, but also because of the short distance and the small communities. And I think that if we were to take some time to understand better and research what it is that is actually happening beyond the small state label, so to say, understanding the processes, I think that that could be valuable also for larger countries.